So anything neurological, so your strokes, your brain injuries, Parkinson's disease, dementia, and then also things like head and neck cancer, anything that can affect this sort of area. Also, just as we get older, like any of our muscles, the muscles can weaken and that can cause a problem with swallowing as well.
And what services and resources does the GHA provide to help those suffering from this?
So we're speech therapists, so because we deal with that sort of area, because the speech muscles are the same sort of muscles we use as swallowing, we have a service that covers both the hospital and the community, so people can be referred into us and then we can help and advise and assess from there. Depending on what's causing the problems, we can prescribe rehab exercises or we can modify diets and drinks to make it the most easiest consistency. We work with people, it's all very individual, and we make sure that people that are having difficulty can live as normal life as possible, because food and drink obviously is so important to all of us and it's such an integral part of our lives, isn't it? So yeah, we work alongside the people and we try and bring up with the best solution for them.
So malnutrition, we normally mainly see it from at the point when the patient comes into hospital, and we do get quite a few patients that will come malnourished and needing nutritional support and input. In the community, we normally might get some referrals, but I wouldn't say it's too prevalent to a degree, because we also have many people who have good family supports. But I guess the other thing to focus on this perspective is that malnutrition it doesn't always mean undernutrition. It can also be overnutrition. So really focusing it from that side, then probably malnutrition is a bit of an issue, because we have a lot of people who are overweight and stuff like that, so who are overeating.
You mentioned that you see these cases when they come to hospital. What medical conditions are particularly associated with this?
A lot of all medical conditions are going to have an input or impact on the patient's nutrition. Sometimes not directly, but sometimes through causing stress, depression, things like that are going to stop the patient from eating. But as an example, I deal with renal patients, and with them a lot of the times just the treatment that they get, maybe if they're on dialysis and stuff, can lead to malnutrition. So obviously we have nutritional supplements and vitamin mineral tablets that we give them in order to prevent this from happening. So it very much varies on the case-by-case basis as well.
And how does the GHA help people with malnutrition?
Yep, so the GHA does a few things actually. When they come into hospital, obviously, get a referral, normally the dietetic team, someone will see them, and at that point, if they need nutritional support or whatever, they will receive it, be it through just nutrition, or if not, we're looking at nutritional supplements, so nutrition meaning food or not nutritional supplements. And obviously, if that's all they need, they'll have prescriptions that they collect from the GP, and we'll monitor them until they don't need anything further. But there are cases where patients beyond that can't really get enough food for themselves, and then we'll have MDT meetings where we'll organise with maybe social services for care packages and stuff like that, also focusing on their nutrition to make sure that it's being met.